director of the MRI Institute for Biomedical Research in Detroit, Michigan. He is a professor of biomedical engineering at Wayne State University, and he is the creator of the Haacke MR imaging protocol for CCSVI testing. One area of particular interest is SWI, looking at iron deposits in the brain. This is the test that we're using at the Applied fMRI Institute in San Diego, and here's Dr. Haacke to discuss his findings.
Well, thank you very much, Lexi. Also to David for organizing this and Arlene for her tireless efforts, and also for many other of you here who I know either both professionally or as people who have been in touch with me before. It's really a pleasure for me to have an opportunity to give you some updates on a few things here. I don't want you to be too afraid that some of the technical slides that I might have, or the fact that I, as usual, have far too many slides. So in order to keep on time, what I'm going to do is skip through a few slides just by making very light comments on them. And David, I'm not sure if you're going to be posting these somewhere, but you're welcome to have a copy of my slides to do so. And that way, if people want to go back and look at some of the things in more detail later, they can. So what I'm going to talk about generally is the role of iron, the applications of SWI to a number of neurological diseases, the role of blood flow to the brain for fusion in MS, extracranial venous problems in CCSVI, quantifying blood flow, the role of CCSVI in other diseases, and then conclusions in future directions. So this is an example of an SWI processed image. As you can see, it shows you a lot of vessels. These are the veins in the brain. Some of these veins are actually only 200 or 300 microns in size, the medullary veins. SWI was originally invented to study deoxyhemoglobin and iron deposition in the brain. Iron generally appears dark in this SWI process data, and so the question is, why do the veins look dark? Well, when the arterial blood goes into the tissue, it's pretty much 100% oxygenated, and when it comes out, it's more like 70% oxygenated. And so what that means is that the tissue has been working properly, taking out the oxygen as it's supposed to. And some of this concept is similar to what Dr. Hubbard has been using for some of the fMRI studies with a different type of technology, but may provide us in the future with a whole brain evaluation of how tissue is working. If we do this at 7T instead of 3 Tesla, and image with very high resolution, in this case almost 200 by 200 microns with a millimeter thick slice, you can see these medullary veins in even greater detail. And so by observing the presence of these veins, maybe we can tell a little bit about how the brain is functioning. Well, there's a paper by and work by Yunin Good of New York University. And basically what he did is he said, let's look at normals and see what SWI looks like. And we see a lot of these medullary veins. But if we go then to somebody who has a more advanced form of the disease, or has multiple sclerosis, so say relapsing remitting, to someone who has a more advanced form of the disease, these vessels seem to start going away. Now that's actually a bit of a conundrum, because if you have reduced blood flow, you expect the levels of deoxyhemoglobin to go up, and therefore you should see the veins better. But we see them worse than we saw them before. In fact, we can't hardly find them here. So probably what's happening in this work is reduced perfusion and reduced blood volume, because if the vessels get smaller in size, or eventually even atrophy and go away, we won't be able to find them. So this is quite an abnormal finding, and according to his analysis, he believes that this is consistent from the PET data, which is positron emission tomography, that it is shown that there's less oxygen utilization by white matter that's under MS stress. And in fact, that agrees very well with these results. So I also want to point out to you that this is consistent with work by people in the last 10 years particularly Matilda Inglese et al., also from NYU, who investigated the decrease in cerebral blood flow in deep gray matter of patients with MS, i.e. they have reduced perfusion to the brain. And that's her paper if you want to read it. And then, of course, I don't have to talk about this one again, but is this consistent with what Tracy Putnam was talking about? Yes, perhaps. Tracy Putnam was thinking there was more thrombosis in the small veins, and so if you gave an anticoagulant, that might actually help. And he was 90% of the way to the right answer. Probably had he had an MR scanner in his days, he would have discovered what Zamboni discovered, that there was a problem not just in the local level, but in the extracranial level as well. So I think his work was very important of its day because it demonstrated that by affecting the venous vascular system, these dogs developed multiple sclerosis. So I want to show you an example. This is a cadaver brain study where you can visually see the presence of two MS lesions. And this is an SWI study that actually shows you iron buildup in both of those lesions. Not all MS lesions show iron content. According to the work of Adams in the 1980s, only about 30% of the lesions show iron content. What is that? It's often in the form of hemosiderin, which means there's been an extravasation of the blood at the edge of the lesion. So the nice thing is that we can now validate this in vivo in a few minutes by using this not on cadaver brains, but actually on living people without having to cut you open. Mike showed this slide here that from Zamboni and also shown by Manzieri in Italy in the 90s and also again Adams, that you can see iron buildup in the venous wall. So some of these areas in the brain may show increased iron content because of another manifestation of endothelial damage. So the blood may not necessarily leak out, it may even be in the vessel wall. And just to give you a little feeling here, this is the MR scan of a cadaver brain, and this is the SWI, and here you can see the comparison of a totally different technique, done near your domain at SLAC, using X-ray fluorescence, which is a method to bombard the tissue with very high-energy synchrotron radiation. This is the iron map that comes from that technology as compared to an in vivo map. So we're not going to stick you at SLAC and expose you to all that radiation. We'll just use the in vivo imaging. So here's an example of iron buildup that takes place. Here's a normal person, age-matched person, and an MS case, and you can see iron buildup here in the globus pallidus. There's again a normal person and iron buildup in the substantia nigra. This is quite varied. We don't just find iron buildup in one place in the MS population. We sometimes see it as a very strong biomarker in the pulvinar thalamus, and it's kind of interesting because the small veins from the pulvinar thalamus are draining into the thalamostriate system. They're going into the internal cerebral veins and eventually up the vein of Galen and through the straight sinus. And in about half of the cases we've studied, we see increased iron content in the pulvinar thalamus. So what type of stress is being put on this system, again, may be consistent with this chronic venous hypertension that Zamboni talks about. Well, this is a bit complicated, but I'm just going to focus on one of the graphs here. This is a graph where we show a lot of normal people between the ages of 20 and 60, and all of these markers here show normal amounts of iron in that age. And this line represents the 95% confidence interval above which we don't expect to see normal people sitting. And in fact, here you have 1 normal, 2 normal, 3 normals out of 100 appearing there, which is statistically correct. All of the triangles, the boxes, the solid boxes and solid triangles are all multiple sclerosis patients. So you can see that there are a lot of people with abnormal iron content, and particularly a lot of young people with iron content higher than 80-year-old normal people. So there is something happening here. How this relates at the moment, we don't really know the physiology or etiology of it. Now, I showed you this similar example before at the beginning. This was sent to me by George Salomon at UCLA. He was quite happy that we could do this in 10 minutes because he's been doing cadaver brains and injecting a dye and then doing a radiographic image to show that he can see the small veins in the brain. And you can see quite nicely now that we can do this in 5 or 10 minutes in living people. So I tell my graduate students, again, we're not going to sacrifice you to do this study. We're just going to simply image the veins quite nicely. I want to show you very briefly just 1 or 2 applications, and this will be something where I'll